Hi, this is Dr. Paul here. I just wanted to respond to some, I get a lot of comments in social media sites. I'm on TikTok, I'm on Instagram. A lot of positive comments. Thank you for those, by the way. A lot of people who really love what I say and agree. Again, not agreeing with me, that's fine if you have your opinions. But it's really interesting in this field of medicine that people, if I ask people like, oh, okay, how would you treat ovarian cancer? And they look at me like, what are you talking about? I don't know how to treat that. Exactly, you don't know how to treat that. What's your course of treatment for diabetes, insulin-dependent diabetes? What do you do for that? I don't know. Exactly, you don't know. How about, let's see, cardiologist? How do you treat congestive heart failure? What do you do with that one? How about kidney disease? How about that one? Your answer is going to be no, I don't know, I don't know, I don't know. But what you might do is well, wait, let me look up the article on Google. Let me see if I can learn. Oh, so you're going to learn how to do cardiology and nephrology and endocrinology by what? Reading an article? So I know people might be laughing now. It's like, of course not. That's ridiculous. Well, yeah, it's ridiculous. But what else is ridiculous? What else is ridiculous is questioning like the science of what I do. People might think it's not real science because it has to do with your thinking and it's just the brain is different somehow. It's not. It's an organ, by the way. But people think it's not real science because we don't have blood tests. We can't do lab work. We can't do an X-ray. We can't do an MRI. We see the brains in there, but we see nothing to do with chemical imbalances. We have no idea with scanning. We have nothing. All we have is understanding the subject of the neuroscience of this, understanding how to treat it, and treating it. And again, I think, like I said, I think so many people think they're experts, or I call it, consulting with Dr. Google, and they read an article and they think, oh, I know more than other, and so you don't. But again, if you're curious, great. If you want to learn more, fantastic. I mean, if anything, if you want to learn, I'm not just trying to sell a book. Read my book. Look at the Corona Protocol, my latest book, and I'll explain to you why I do things the way I do and how I think the way I do. But like I said, it's a field I love, but it's not so much frustrating because you're going to have the haters always. You're going to have the people who say, "Oh, I'm just doing this to get, to work with pharmaceutical companies to get free food," or, what else? What are the other claims out there that this isn't real science? There's no such thing as chemical imbalances. I mean, a lot of these really severe people who write paragraphs and paragraphs and paragraphs of hate. They might be Scientologists who are very anti this field of medicine. So some of them may be Scientologists that I'm hearing from. And they want to read Dianetics and figure it out by L. Ron Hubbard. Okay. But this is why I think it's important to understand that this is treatable. And the good news about this is that it's actually treatable and that people can actually feel better. And when people think, well, feeling better, you should just do that with exercise and diet. Well, sure. I mean, I talk to my patients about those things. Absolutely do those things. But it doesn't discount the fact that that's not enough for a lot of people out there. A lot of people really need more of a medical treatment plan. And that's all it is. It's medical treatment. It's balancing things that are out of balance. How do I know what's out of balance? Basically, I know from trial and error. I mean, it sounds strange, but I get a lot of information from people. I have a really good way of figuring out how to do things, and I try it out. And if it works, great. If it doesn't work, I learn something. I like, okay, well, it's not that. It has to be this. So there's a lot of this trying, and it might look like I'm just throwing darts at the dartboard, but I'm not. I mean, there's a rational basis of me doing everything that I do. It's just there's no test for it. The test is actually the treatment. If what I give is correct and it works, and they're feeling great, or their anxiety's gone, or their depression's gone, or whatever, then I know that I was right, and I know the treatment's right. So we have to kind of look. It's kind of like understanding that we get the treatment right after the fact. We can't know that initially before, like with other areas of medicine, which might have more specific ways of doing things. This is a lot more of a feel for it, a lot more of understanding people and how they feel. And And anyways, that's why I love this field of medicine. But yeah, but so for the haters and the doubters out there, you can do that. You can do that all you want. But unfortunately, so many people out there that need help aren't getting it. And part of the reason they're not getting help is because of this mentality, this anti-medication mentality. I'm not a pill person. I don't believe in this. Okay, so a lot of people who are suffering are never going to get better. Their whole life will be spent angry about this, angry that I even mention it, and then they live their life that way. When you could feel better if you just give in and say, look, you don't know everything about this. You might actually, there might be someone more like myself who knows more than you do about it, and so maybe I can help you, but maybe I can teach you some things you don't know. So I love teaching patients. I love explaining, and you've seen my diagrams. I love explaining to people, here's what I think is going on, and see if I'm right. And in medicine, we're not always right. With other areas of medicine too, we give an antibiotic. It doesn't work. Okay, well, let's try this antibiotic. For a bladder infection, for whatever, a blood pressure medication. Oh, that's not working. Okay, let's raise the dose. Okay, let's switch to a different one. All that stuff in medicine happens, and people aren't going to criticize them as much because they seem more real. So anyway, I just wanted to give you this message. Hopefully this helps.